Often I actually get asked, is there a connection between coccygeal, coccydynia, that's tailbone pain, and the pelvic floor? Well, the simple answer is yes. um, so there's a very clear anatomical and clinical connection between coccydynia, that's tailbone pain, and the pelvic floor. So pelvic floor dysfunction is considered one of the key anatomical considerations, causes for chronic coccyx pain. As you can see, it's a very complex area. So there's all the fascia, the connective tissue, the internal structures, and as you can see here, this is the body of the perineum, and the anterior, the urogenital part of the perineum blends into the pubic bone, and the posterior part of the perineum blends directly into the tailbone. So, there's a lot of structures in there. And when you see here, you think, here's your pelvic floor that sits quite nicely, base of a pelvis. And all the structures blend into the back of the sacrum and the coccyx here. So it is a huge consideration when we come to coccydynia, tailbone pain, and even sciatica as well. I think it's amazing now that the pelvic floor is becoming one of the most recognized part of mechanical structures and functions of our back, hips, and our pelvic floor itself. You still have to look at a whole picture when it comes to your pelvic floor. So is there any restricted movements in the thoracic spine? Restrictive movements or poor alignment here in the lower back? Posture plays a massive role as well. Is it our hips? Because basically when we sit, what's happening to our pelvic floor is we move and work through the day. As we sit, we're actually opening up the pelvic floor, and we could be causing weakness, we could be causing tension depending on our posture. There's multiple factors as to this connection to our pelvic floor and coccyx and everything else, because everything blends into there. It's the lowest and most important part of the core as I'm concerned. In pregnancy, when there's hormones involved, obviously. So what happens is the pelvis has to move this way so the baby's head can crown. And then when it's time to give birth, the pelvis will move and open so that the head can pass through the birthing canal. If you're suddenly rushed off for a C-section and you're still stuck in that first part of movement and you haven't actually gone through the whole process, or even if you've had other interventions, it may be a case that you have residual postpartum issues. You're stuck maybe in a flexion pattern here of the sacrum. You could have flexion and rotation. And this can actually go on for years. So what's happening to the internal structures? You might actually find that when you're examined internally, that there will be areas of tension, there'll be areas of laxity. So you could have a hypertonic or a hypotonic pelvic floor. And all those structures there cause a misbalance, they can cause a pull, they can cause a rotation, and we don't have that mechanical balance within our pelvis. Simple things like standing more on one leg. We don't think about it, and we weight shift over to one side sometimes, or we cross our legs constantly. That's having an internal impact on all the structures that we have within the pelvis. So when you do have coccyx pain, traditionally we use things like cushions, but I get really excited when it comes to internal pelvic floor mobilizations because it's such an interesting area. You have to look at the person as a whole though. What's their sitting posture like? Are they tending to sit back more onto their sacrum, so they're causing a tension pull somewhere within the pelvis and onto the coccyx? We've got this sensory and motor innervation of the pelvic floor muscles, so that can cause dysfunction. you have to take a whole picture when it comes to that. Look at the biomechanics, you look at the abdominal pressure as well. So are we holding things too tight? Are we breathing more up here? Can we relax and release everything? So yeah, you just have to look at everything when it comes to coccyx pain. Oh, excuse me. So I think it's really important when you come to coccyx pain that coccydynia, coccygeal pain, whatever you want to call it, that you work internally so you can find those areas of tension and those pull and those areas of laxity. So what you're going to do is like any other tight, tense muscle, you can actually work very gently. You can press and hold. You can do some other structural work, other internal massage, and that can help release the tension. So how the SomaFlex works, so when you actually wear it internally, basically what's happening, it's moving as you're moving. So this is what it would look like internally. You can see how the structures, the pelvic floor, internal connective tissue, fascia would sort of sit and hold around the SomaFlex. And as you move, it will move, causing some internal massage, very gentle mobilizations, and it helps the weaker hypotonic pelvic floor muscles to engage more through proprioception. And then you also have the tight, tense, hypertonic muscles that will just literally be moved and gently mobilized as you're going through your day. So if you do have coccyx pain, especially chronic coccyx pain, maybe it's worth looking into your pelvic floor structures, get your assessment from your pelvic floor physio, specialist nurse. And there's lots of pro fitness people out there that can help you work and explore positions and exercises so that your pelvic floor can engage externally and influence the internal structures too. So anyway, I hope that helps. Pelvic floor dysfunction, problems in pain with coccygeal, coccydynia, tailbone pain, whatever you want to call it, hip pain, back pain, pelvic floor can have massive implications. So I hope that's just helped you think a little bit more outside the box and just think, could that actually be coming from my pelvic floor?